Medical billing used to be a quiet back-office function. Today, it has mutated into a primary source of operational stress for independent practices. According to MGMA data, 1/3 of medical billing personnel separate within 12 months. Replacing them is practically impossible. Over half of practice leaders report finding qualified candidates is their top challenge. The talent pipeline has run completely dry. Constant staff turnover creates a structural failure in the traditional practice management model that a single hire cannot fix. A fully loaded in-house biller costs $55,000 to $75,000 annually when factoring in taxes and benefits. Uncredentialed hires require a 90-day ramp of partial productivity. When they leave, the financial hit compounds, costing up to $30,000 in replacement penalties. While the billing desk sits empty or occupied by a trainee, the revenue cycle continues. The average claim denial rate sits at 11.8%, and each denied claim costs $25 in rework time. This chart tracks the probability of recovering funds from denied claims over time. Once untouched claims pass the 120-day marker, the chances of recovering that money drop precipitously below 40%. An operator must accurately capture superb bills from clinical notes, move them through scrubbing and clearinghouse gates, and finally manage reconciliation across incredibly complex payer mixes. High-performance billing requires EMR-native operators who can bypass the software learning curve from their first hour on the job. Instead of trying to out-recruit the market, independent practices are bypassing the hiring, training, and retention cycle entirely. They are plugging into dedicated outsource teams that are already built for the job. Staffingly provides AAPC and AHIMA-credentialed experts who are natively trained in the Elation environment and completely ready to work on day one. This timeline maps the 14-day integration process. Within 2 weeks, the team securely sets up EMR access, aligns protocols, and goes live. This access is protected by enterprise-grade infrastructure. Data flows securely through encrypted VPNs, maintaining strict HIPAA and SOC 2 Type 2 standards. Practices demanding secure, immediate expertise use this model as a standard operating procedure to bypass the traditional HR burden. This scale compares the financial weight of both models. On the left, the heavy burden of an in-house hire. On the right, Staffingly's outsourced model. At $399 per week, it generates an immediate net savings of $34,000 to $54,000 per seat annually. This equation completely eliminates the massive hidden costs. There is no benefits load, no 90-day training ramp, and zero penalty from staff turnover. The numbers make the traditional in-house hiring model functionally obsolete. Premium credentialed accuracy costs thousands of dollars less than managing in-house chaos. Staffingly backs teams with AI-augmented workflows. These systems dynamically route claims based on specific payer rules to prevent backlogs before they can even form. This gauge reflects the ultimate operational result. Staffingly maintains an error rate securely below 1% across a network of over 800 practices. The decision carries zero long-term risk. After the initial 14-day pilot, the contract operates strictly month to month, meaning there are no long-term lock-ins or cancellation penalties. Solving the Elation billing crisis allows providers to stop managing human resources headaches and return their focus to patient care. Start your risk-free pilot today.